Neuro ICU was my specialty.
Neuro
Neuro
ICU?
ICU. Yeah, I love the brain. I love the elderly population. I love, oh my goodness, do I love elderly people. I just want to kiss their little cheeks and hug them and listen to their stories. Um, and neuro, you have to get to know your patients so in depth that if there's any small change and the vital signs won't reflect it,
Yes.
you just know that something's different. And sometimes that's the difference between them having a forever injury and, being able to
And
intervene.
Yeah, no, you're right. Because a lot of the times, even like in nursing school, and when I worked at the acute rehab, I worked on the brain injury stroke floor. Um, and every time my nurse manager, my nurse professor, my preceptor, every like person that was in charge always said, in the elderly population specifically, even it like, yes, obviously you're on a brain injury floor, but in the elderly population specifically, cognition is the first thing to go.
Oh,
And a
yeah.
lot of people are like, homegirl is, grandma is just old and she's forgetful, or
Yeah.
grandpa is just, he can't hear you and he's senile. No, things
Mhm.
are happening and you
Mhm.
need to keep an eye on the prize. But when I don't know, I just feel like that's one of those situations where we as a profession need to start, I don't want to say start respecting the patient's family more, but at least start hearing them out a little bit
Oh,
more, because
man. Yeah.
it's always they come in and they're like, this is not my dad, this is not my uncle, this is not my husband, this is not what they usually do. And you're like, yeah, that's because they're in the hospital. But no, hold on, just hold up and just give that lady, the significant other, that family member, a second to explain why she is a little concerned. Because
Mhm.
maybe, I mean, that could be, the doorway into, let's do a CT scan, let's just do a brain MRI, let's see what's
Yeah.
going on.
I do rapid response now nursing over at UNC Rex, which that is by far the coolest gig I've ever had. And I mean, I worked at Johns Hopkins as well. I worked at the largest neuro ICU in the world. It was a 64 bed neuro ICU out in Phoenix. But this gig is incredible. But I got called for a possible stroke and ran up there, went through my quick assessment. And of course, you always ask, well, does this patient have a history of dementia or Alzheimer's? Do they sundown? It was an older person. And the family's like, no, he's sharp as a tack. And I was like, okay, cool. And then he started waking up and he was doing great. And they're like, oh, he's back to normal. We're good. And I was like, no, we're not good. We need to go down. So pack him up off the floor. We're going down to CT. The guys, I think it was his right ICA completely occluded. So
Oh,
from the
jeez, of
time to the
Lord
floor to the
mercy.
CT, like he had left sided deviation. He couldn't talk. He started guppy breathing. And it was just, but the family, they were right on it. They're like, nope, this is not him. This is not, yeah, it was pretty
Did you
incredible.
just say guppy breathing?
Yeah, like
Is that a technical term?
I think so. Yeah, it looks like a little guppy fish where they can't get oxygen.
Jamie, I'm sorry to break it to you. That is not a technical
That's
term.
my technical term. Agonal breathing, but they look like a guppy.
I love that. I've never heard that before. Do you guys say that, or is that just you? Is that
I
a
think it's
thing?
probably just me.
I love that.
I'm starting
Oh,
it. I'm starting a trend. It put the picture in your
guppy
head, though. You can
breathing.
see
Of
it, right?
course. I know exactly what you're talking about. That's fantastic.
Yeah.
Oh, that's
So,
funny.
so like this, you worked in enough areas that, I mean, just for instance, there's times where in the ICU that us as nurses and even physicians were like, this family really needs to make this patient a DNR. We need to remove the ventilation, like tracheing and pegging the patient. They're not even gonna be able to go to like a long-term acute center or like a skilled nursing facility or any of those places. But yet we don't get to make that decision, even though we know that's not a good for everything. We're going to make them suffer maybe a week longer before we can't do anything else.